Hello. Hello, everybody. Welcome again. Welcome back again to another episode of Intercultural Conversations. And actually, today I'm very excited about today's episode because it's something that I myself probably wouldn't have imagined having to be as a concept, because even though I have been an interculturalist for so long, I think I have never looked at it from a perspective of public health. I would assume that health means the same for each and every human being, but apparently, no. Actually, culture really affects what people perceive about health, what public health policy decisions are actually also affected by, depending on the country and culture. But by countries, I don't specifically mean from only a policy level, but also, on a cultural level, on a social level as well. So I'm very excited about today's conversation, and we are going to be joined by Dr. Anukriti Chhabra. And I'm just going to add her before I introduce her to you. I've just sent her the request. She should join us, I'm assuming, in a couple of moments. Hello.
Hi, Pratha.
Hi, Dr. Chhabra.
How are you?
How are you doing? How are you?
I'm fine, Pratha. Good evening.
Good evening. I just want to make sure that you can hear me and everything is good, and everybody else also can hear us. People who've joined us, thank you for joining. Am I audible, Dr. Chhabra?
Yes.
Okay. So, I'm just going to give a little bit of an introduction to you for my audiences. And if I miss out anything, please don't hesitate to add. Right?
Yes. Okay,
So,
Pratha. Yes.
I think Dr. Chhabra, Anukriti, has a long list of achievements, and academic achievements and professional achievements. And I think it could take the entire show. So I'm just going to probably mention some parts of it. She is a BDS and an MDS from Manipal University. She's an TIS alumni, where she studied public health. She currently works for an organization that consult larger organizations, you could say, like World Bank and WHO, on public health initiatives, policies, and decisions. And today she's on Intercultural Conversations. So thank you. Thank you so much for being here, Anukriti. And if I had achieved whatever you have achieved up till now, I would not be modest about it at all. It would be everywhere. And thank you.
Thank you, Pratha, for calling me for this talk.
You're welcome. So have I missed out anything, Anukriti? Have I covered most of?
Yes.
Okay, so let's just dive into it, actually. Like I was mentioning before you joined, public health can also have, or decisions about public health or perception about health in general can also be influenced by culture, right? I wanted to get your perspective on, are there differences in the way people actually perceive health in different cultures, not only within our country, but outside as well? Could you just shed some light on that so we get an idea about it?
Yes, Pratha. So the whole story behind how this talk was arranged was, once Pratha was telling me about her work as an interculturalist and how she trains people about various cultures and adapt to it. So I just happened to tell her that, culture is very important in the healthcare sector also, and, in making people understand about the concept of health, about diseases, about illnesses. And then then we thought that, let's have this conversation live. So that was how it was planned. So yes, so today we are mainly going to discuss about, how every time the concept of health and disease and illness is looked from a very biological point of view, that, there might be some physical ailment in the body, so the person is considered to be ill. But we have to start thinking beyond it, and there is a lot of socio-cultural influence on health, not only on the state of an individual, like the health of an individual, but also in concepts about how an individual perceives the health, how he perceives
Yeah.
illness or a state of disease, how the illness is perceived by people around the individual, like the people, the society where the person stays, how one's illness is perceived by others around them. Then it also influences, there are a lot of set of beliefs and values which societies or different communities or each individual holds for various factors, and one of that is that there are a lot of beliefs and values behind health conditions also which people have, and all this in turn affects the perception one has about their health status or their disease status. It also affects how they are going to express their health status, and it also
Mhm.
affects how they are going to start seeking treatment or help for any particular ailment or any disease which they have, and it also affects that what type of treatment they are going to accept.
Okay. So have you then noticed actually differences culturally? Probably do you have any anecdotes of how certain regions, for example, it could be a possibility that how Europeans perceive health and how Indians would perceive as health. Is there a stark difference in how that is, or even you never know, maybe even the north and the south? Is there a difference in the perception?
Yeah. So, like in within our country only, there are various differences in how people perceive health. Like there is a difference between how the people in the rural area perceive their health status as well as in
Mm.
the urban area. So that is also a very big difference about how people perceive their health or what is the cause of the disease. Like for example, there are certain villages and there is certain tribal population where people believe that their physical condition or their illness is because of some past sin they have committed, or because of some wrath of the god, or because of some karma which is coming back to them, and they consider that to be a supernatural cause. They never consider it to be a natural thing
Medical
or
cause.
some
Yes.
deviation in biology or any scientific background of the disease. They consider it to be something very supernatural, and that in turn affects the way they are going to seek treatment. Like they will not go to a qualified doctor, maybe they will prefer going to a traditional healer. So that is
Okay.
one example within, and this is not only in India. Like there are many tribes in Afghanistan, countries like Afghanistan, who still feel that their health condition is because of some past sins, and the supernatural causes are there behind it.
Yes. And now that you're giving these examples, it just reminds me of the fact that when I was living away from India, I don't know if it's a cultural thing, maybe you can shed light on that. There is such a dependence of self-medicating because
Hmm.
medicines are accessible over the counter here without prescription, usually. And I noticed that I would self-medicate a lot, and only if it would be a very dire situation that I couldn't handle it myself is when I would visit the doctor. And that would be very
Hmm.
shocking for my friends or my colleagues over there, because that the
Yeah.
usual reaction is to get medical help as soon as possible. So yes, I can definitely understand how then that creates a difference, um, even with respect to rural and urban and tribes in different
Yeah,
parts of the
so
world.
that depends. See, like for example, there are certain cultures who pay a lot of attention. Like for example, even if there is weakness in a if one feels weak, they will start feeling that they have deviated from their condition of good health, and for that they might
Hmm.
seek a help from a doctor or any healthcare provider, that they have a feeling of weakness, or um But then there are certain cultures who just let it go. Like they will say that, okay, this is considered to be normal. It is not a deviation from health, and it is just like there are. If you see, it also varies from household to household. Like some households, if one is feeling mildly sick or they have a cough or a cold, they will not go and seek any healthcare treatment for it. They will just, take it very lightly. But then there are certain households and certain individuals who, put it on top of the world that no, I am feeling sick, I have a cold, and even a minor cold is such a big thing. So this will determine at what stage an individual will go to seek healthcare from the doctor. Like, will they go at a very initial stage where there will be minimal requirement, or will they go when the disease gets very severe? So that perception of severity also varies between different cultures. Like, for example, there are certain cultures where men are supposed to keep their pain within, and they will not express it, and they are supposed to have a very stoic approach towards life and all. So in those setups or in those places, we'll see that men will not, express their pain. If they feel that they are sick or their health is not fine, they will not express their pain, and that's why they will not even go to seek treatment. And that is why it is seen that, in most of the places, like a lot of studies have been done, but then it again varies from culture to culture, that it is said that women seek healthcare treatment more than men, because women are in the society, or in certain cultures, women are allowed to express their pain more, and they are allowed to express that they are feeling sick. But on the other hand, men are, they are not promoted, and they feel that they will be considered to be weak, and that's why they will not express it.
That is such, oh God, I've never ever looked at it from that perspective, Anukriti.
Hmm.
I've never looked at it from that perspective, that from a gendered perspective, that possibly because
Hmm.
in certain cultures it is essential that a man is stoic, like we say in Hindi, mard ko dard nahi hota, and that could
Hmm.
also be kind of a inhibition for them to then go and express their pain, because that could be a sign
Yeah.
of weakness, and that's definitely a reflection of how patriarchy also affects men in that sense.
Yeah, but then
Thank you for bringing it.
this can also be the opposite. Like, it also depends. Like, for example, in some societies, the whole autonomy and the decision-making process depends on the man. So
Right.
sometimes the whole decision to take the women to the doctor will depend on the man, and there are certain situations where women are not comfortable in sharing their personal ailments or their personal problems with men, and that's why they might not put it out in the open, and they might not go on their own to seek healthcare treatment, because they don't have that autonomy, or maybe they don't have in enough finances by themselves. Like, they are not the person in the household who will take financial decisions, so they will not go seek the treatment necessary. So that all depends upon
Yes.
culture to culture, that who will be the head of the household, how freely people are able to express their pain, how women in the particular culture are allowed to express their health status or about their personal problems. Hmm.
Yes. Yes. And wow, that's actually very insightful. And I hope that changes, because this is something that directly affects your body, and such things shouldn't be an hindrance for you to seek help. And because
Yes.
people generally hesitate to seek help even for their mental health, and that's a taboo.
Yeah.
And
Yeah.
if you're also creating a taboo in seeking help even for your physical body, which is of course equally important but less of a taboo, generally it can be it's painful. I hope that
Yeah.
changes, and I
Like,
think
for
it's slowly
example,
changing.
there are
Yes.
certain diseases which are very heavily stigmatized, like HIV and HIV and sexually transmitted diseases. So people will not come out in the open, and they will not go to the healthcare provider, because in that culture or in that society there is a stigma against these diseases. And in these situations, even the healthcare provider or the practitioner or the doctor who they go to, they might have that fear of judgment, that he might judge us, or they don't want the word to spread in the society that so and so person suffers from HIV. So they will not seek treatment, and that will just deteriorate their condition. So these are
True.
certain cultural factors which will. And one
That's
more point I
actually.
wanted to. Hmm.
Hmm.
Then,
Please
for
go ahead.
example, like if we see organizations where we work where it, so we have seen that different organizations have different cultures. So there is this whole concept of sick leave. Okay, so if I, as an individual, say that I am feeling sick and I am going to, take leave for that. So there are a lot of organizations who want it stamped from the doctor, like from the healthcare provider, that you have to get a certificate that you are sick. But then
Right.
there are a lot of diseases which are invisible diseases. Like for example, if we talk about mental health, so now they have come up with the concept that people can take off, or they can take mental health off and all. But mental health is not such a thing that I can go to the doctor and the doctor writes that I have some mental health issues. That is for me to determine, and I can say it. So this the whole concept of sick leave also comes into play depending upon the culture of the organization. Like certain cultures will not accept that you can take leave without having a medical certificate. But there are many
Hmm.
conditions, like for example, if I just feel very weak one day and I might not want to go to the doctor and I might just want to take off. So getting that whole proof and making the whole policies behind how people can take sick leave, for that also the culture of the organization plays a role.
Yes, it's the culture of the organization and the country where the organization is
Yeah,
based that definitely affects such policies within corporates as well.
yeah.
So yeah, and then it also becomes about the messaging. It also, because even if we want that change to happen, people need to
Hmm.
understand that it needs to be communicated to them. Yes. So
Hmm.
in the public healthcare domain, do you think communications or communicating either advices or policies also differs from culture to culture, that you cannot
Yes.
communicate about certain? Yes. Do you have any
Yeah, like
examples or
there is
opinions?
always this concept, like for example, if we are making some healthcare program and we are trying to provide a healthcare intervention, so all the promotional messaging which is done behind it, that has to be very culturally sensitive, and we have to keep in mind that no one is offended, and it has to be as simplified as possible. Like for example, if we just put across any message, and the same message is translated into different languages for different people, so sometimes
Mm-hmm.
that translation only changes the meaning of the message.
Yeah,
So that
it gets lost in
translation also.
translation. Always happens.
Hmm.
Yes.
Yeah. So that has to be kept in mind. Also, the background of the people for whom we are making these health promotional messages, and what are the values of the people for whom we are making it. Because mainly we want that the population should have trust that what we are providing them, and they should have trust, and they should not feel that we are being coercive towards them, that they have to use it, or anything which is going to offend them, or something which they do not understand. So, for example, like for the prevention of malaria, okay. So there are certain people and there are certain communities who still believe that malaria is not caused by mosquitoes. Okay, they feel that there are some supernatural causes for malaria, and so there is a program made where there are mosquito nets which are impregnated with insecticides, and they are provided to the I mean, people are asked to use it while they sleep, that they should put these nets. Okay. So, simply putting across a message that you have to use these nets and they will be provided, it will not bring about a change in behavior of people actually using the nets, because they don't believe that mosquitoes are causing malaria. So, they
About
will
malaria in
question
the
it
first
that way.
place. Yes.
So the communication has to be structured this way, that first we have to make them understand that um, what is the cause of malaria. We have to explain to them what are their current beliefs and practices. We have to try, I mean, we cannot just go and tell them outrightly that that is not and you are wrong. We cannot wrong them or anything. We have to go very slowly. We have to educate them, so that way it has to be very culturally sensitive, all the promotional messages. Like for example,
I
if
can
we see
complete.
leprosy.
Yes. Please go ahead.
uh, yeah, so for example, if we see the example of leprosy, so there are certain pockets in India where leprosy is still very prevalent, and uh, perhaps the reason that it is still prevalent is because people over there believe that leprosy is because of past sins an individual has committed, and they try to hide the disease and they don't seek treatment. But then, so for that, certain programs were made so that, rather than the people coming to the healthcare center, we will go home to home and check. There are programs where people, healthcare providers, go home to home to check whether any person has leprosy, and then try to explain to them that it is a disease, it is nothing to do with God, and then try to make them take treatment for it.
Yes, I can understand. And these culturally, it's very nuanced, right? Because
Hmm.
the beliefs that these tribes have, or not necessarily tribes, but the beliefs that the people have uh,
Hmm.
about certain things comes from some place that can't be challenged always directly, right? Because
Yeah.
there has to be a discussion. It can't be challenged
Hmm.
because this is something that is they draw their identity from. That's something that
Hmm.
they draw their beliefs from. And if you want action to be taken, then it has to be communicated in a sensitive way, of course, but in a way that's more acceptable to them as well.
Yeah.
Right? Because
Yes.
as interculturalists, we always say there's no right or wrong, right?
Yeah.
The fact, but what happens in science is that there's a clear black and white,
Yeah.
usually.
Like.
As far as I know from a third person's perspective, there is usually a black and white, there is usually a right or wrong, there is a solution
Hmm.
and an antidote also.
Hmm.
So then it becomes kind of a dilemma. How do we handle this situation? So I can understand that how communication can play a very important role, definitely, in public health, for sure.
Hmm.
And
Like, for example, if we see about diabetes, okay, so India
yes,
is considered to be the diabetes capital, and since a lot of years we are trying to reduce the prevalence of diabetes amongst people. Now, we have the medication, people are eating the medicines, they have all the biological solutions for reducing their sugar levels, they will take insulin and they will take other types of medication, but then that also has to be accompanied by certain lifestyle changes. Like, for example, the diet of India is very carbohydrate heavy. Okay, so we
yes.
cannot just one day come and say that your diabetes is because of eating too much rice, so you have to stop eating rice. Because in the
I'm
culture,
a
it is
South Indian. You
so,
can't tell
yeah.
me that.
Um,
Like if you were to tell that to a South Indian, the first reaction
hmm.
is offense. I can
Yeah,
understand.
yeah,
Yes,
yeah. So, we have to tell it to them in a way that, maybe slowly, slowly make them reduce the intake of rice, try to explain to them, try to explain the alternatives of what else
hmm.
they can eat, and try to tell them that, we are not trying to devoid you of any pleasure of eating rice or anything. It is just for the health. So, this communication has to be done in a very sensitive manner so that people don't take any offense also. And also, it
Yes.
has to be done in.
Please go ahead, Karen.
Yeah, also it has to be done in a way like so that people will understand. Like, one good example is like when we are making when policies are being made for nutrition, or national policies are made about nutrition and all. So usually we use words like protein, carbohydrates, and fats and vitamins, and sometimes these words are not going to be understood by layman, and they might not know that that education is very much needed for them. So Brazil as a country, when they made their food policy, so rather than using words for nutritional words like carbohydrate, protein, fat, vitamin, and amino acids, etc., they made it using food words like they gave examples which people will understand, that you can eat rice in and they made diagrams showing examples of food plates, like, and they used very simple words like meat and vegetables and rice, instead of using nutritional terms which people usually are not aware of. So,
Yes, that makes so much sense, because that's the issue I have with medical terms and terms related to law. Because I think the language of it, even if it's in English, it just seems so complicated for people,
hmm,
layman who has not dedicated their life to actually studying this or learning this to understand. So I think simplifying it is definitely a valid solution. And I think Indian government also tries to do that. I
Hmm.
think with a lot of communication, especially in the rural areas. And yeah, I mean, this also leads me to a very current situation, because I think COVID for me as an interculturalist was, of course, like for many people, it was a very sad time, but it was also a very observational time for me because I was just seeing the different behaviors of different cultures during COVID and their acceptance of the disease, acceptance of the intensity of the disease,
Hmm.
of the virus even, or the existence of the virus even. And there was so much overload of information also that happens now,
Hmm.
and we see the result of it in being anti-vaxxers and pro-vaccination groups almost that have been created. So, did you notice? I mean, were there huge cultural differences when it came to which kind of culture actually wants to accept vaccinations, or there's a certain amount of
Hmm.
um, trust in the medical community also. Do you think it differs culturally?
Yes, so see, like there are a lot of cultures. Like I will avoid taking any names so that no one takes offense or anything. But there are certain cultures who still believe that if the like the government has some agenda behind giving them these vaccinations, and those vaccines are like foreign substances which are going to hamper their regular bodily functions. So those whole group, like they have this whole group of anti-vaxxers, and they are absolutely against vaccines, and they do not have any trust or any faith in whatever research is being done. And especially in the times of COVID, where usually a vaccine takes about 7 to 8 years for getting approved and coming into the market. But in the time of COVID, it was done so fast. Like within a span of 7 to 8 months, they came up with a vaccine which got approval. So that further added to the mistrust amongst people, that how can it be done so fast, wherein in the past it has never been done this fast, any approval of any vaccine.
True.
So in such cases, usually what is done, like the usually the government only puts across these messages that vaccination is necessary and we must take it. So some people do not have that much trust in the government, but they have more trust in their faith-based organizations. So in these cases, we try to go and educate their leader, or their religious leader, or their local leader, and try to tell them to explain the community or the population in a way which they will understand that vaccination is necessary and it is not going to harm them in any way.
Yes. So then there's a matter of trust with the government, and how much do you actually put in your trust with the government, and that definitely differs, or the expression of that definitely differs from one culture to another.
Hmm.
Because there were a lot of anti-vaccination protests that were happening in France, and France in general is a country of debate, is a country where authority will be questioned. Okay? So
Hmm.
that was extremely shocking for me. And the way then I looked at anti-vaxxers in the United States is because it's a very individualistic culture. So nobody can impose anything or force me as an individual to do anything in order to exercise my freedom, for example. So I think culturally it differed
Hmm.
very much, wherein India is a much more collective culture, right? So there is a
Hmm.
collective trust, and there is also it's also very hierarchical. So there is a trust in the higher authorities. There is a trust in professions. There's a trust in the medical community because the assumption is that they know more, hence there is more
Hmm.
respect, and hence I
Yeah.
shall listen, or we shall listen together. So, I could just see the differences in culture being reflected in how they perceived COVID and how they perceived the solution for it as well,
Yeah,
for sure.
like for example, even to get about that behavior change for people to start wearing masks. Like initially, people were very resistant to wearing masks, that we are not going to wear it, and people just stopped using them, or they never used them, even though there was so much reinforcement that masks are necessary. So that problem we had seen during COVID times, that it took so much time to get about that change in behavior for people to actually start putting a mask on their faces while going outside.
True, true. And do you think then, because again, I go back to the access of information. Now we were just too much access to information. Sometimes I also believe it's about how you use it rightly. So, do you think generationally also, because culture is not, of course, restricted to boundaries of geography, there are also, generationally cultures can be different. Do you think the current generation has a very different perception of health, firstly, and trust towards the medical community and public health in general than the previous generation, especially the millennials or the Gen X, Gen Y?
Yeah, so see, as the times are progressing, the amount of education which people are receiving, plus their exposure to their exposure to media and their exposure to advertisements is also increasing. So of course, people are getting more educated, and they have a lot of knowledge regarding various diseases, or regarding the healthcare facilities, or any uh, any healthcare situation. But that is also happening because organizations who do this work, even they are becoming more inclusive in their policies, and they are trying to include all the aspects, and they are trying to make different messages for different type of people. Like for example, if we want to put a poster for any disease, like for example, if we want to put a, let's take COVID vaccination, that we make a poster that uh, people should go and take COVID vaccination. So putting that poster in a village will not make any sense, because people might not look at it, and even if people look at it, they might not understand it. So over there are audio messages which are put, there are ads played on the video. So even the messaging part, and even the promotion part, and even not only messaging and promotion, but even various programs are getting more inclusive. And so it is both ways, like even people are getting more educated, and they're getting educated by themselves also, and also because the facilities being provided to them are getting better and more inclusive that way.
So yes, so public healthcare, so your understanding is that now for this generation, public health is actually becoming more inclusive, irrespective of the country. So even in India, public health is definitely getting more inclusive, also for all socioeconomic classes. You think? Because see, you
Mm,
know, during COVID, we clearly saw a divide. We clearly
mhm,
saw a divide who had access to things, whose lives were affected more and less. And that's a dreadful thing to watch. And I remember being in France and watching the news about India, and in the news everything just seemed much more exaggerated, but it was not. It was reality. And
mhm.
I definitely saw the lower income strata of society being more affected in countries like India, right? And I think that's one place where I feel public health is not yet as inclusive, but I can also understand that India is such a populated country,
Yeah,
right? It
and then
it
we all
becomes
that
very
see
difficult to centralize.
Hmm. And resources are always limited, you know. So, I mean, every effort is being taken so that there is universal health care and all. So, maybe we might reach to it at some point of time, but it is still in progress. And mainly in this, like, culture will play a role. Like, for example, if we just make a very good hospital in a place where as per their beliefs and values, they are not going to visit the hospital. So even making a hospital is not going to serve any purpose unless people are actually going to use it. So,
Hmm.
for example, nowadays, like in the past 4 5 years, they wanted to stop, they wanted to limit and control the practice of open defecation in India. So in the villages, they feel that it is that is a normal thing to do, and uh, uh, going and defecating in a bathroom is what city people do, and that is not a practice in the villages and all. So even though a lot of bathrooms were constructed in villages, people never went and used them because they were not. given any education, or suddenly just constructing a bathroom and expecting people to go and use them. We have to have a lot of programs and a lot of education which has to be given to the people to actually make them accept that change.
Yes. So it's not only about taking the action, it's also about having grassroots information and education that's given so that they
Hmm.
understand why certain things are provided or not. Because if you grow up
Yeah.
not having a bathroom, which is which for many of my audiences, especially who are around from from different parts of the world, which may sound very shocking, but there are people who don't grow up defecating in bathrooms because they don't have access to bathrooms. And even if there are
Hmm.
public access to bathrooms, they're not very clean or sanitary. And if
Yeah,
open
and then
defecation,
people
for
don't want
example,
to bring about that change in behavior. Like even if an intervention is being provided, people might not take it up. Like even in COVID for vaccination, like vaccines were provided, but there was a large society who had fear, they did not have trust. So it took a lot of time to actually educate them and to get that trust into the system that that is what is the need of the hour and it has to be done. So that becomes very culturally sensitive thing to do.
yes, I
So
think
that
it's
is where.
cultural, it's also conditioning, it's also
Hmm.
behavioral. I think this
Yeah.
part of it, trust in general, of course, differs. How much I trust somebody also differs culturally, but it also is so unique to individuals and it's so behavioral and it's so psychological as well. I think we need to have another separate conversation just talking about conditioning and behaviors of diseases. And
Yes.
we are almost, yeah, we are almost 40 minutes in. So
Oh.
yes, but before I let you go, Dr. Chhabra, what I do with all my guests is I ask them a question about what they would like to change either within themselves or outside of themselves. Because I think
Hmm.
change is my new word now. And I don't mean change
Okay.
in the sense that I'm going to change the world. There will be no hungry child that exists. I hope that happens. But that's not a feat that I want to carry alone. But,
Hmm.
if there's anything that you would want to change within or outside yourself, what would it be?
So there is this saying that says that change begins from within. So like some not sometimes, like sometimes I wish that I feel that people should be more patient and more adaptive to various changes which happen, and I want myself also to be like that, like so that I can be more patient and I can start accommodating to new things, or for receiving new facts and trying to unlearn what we already know to newer things. So that should be there, so that even within the people we live with, they are more accepting for each other.
Yeah, yeah. That's beautiful. I hope I hope people find patience. I hope I find patience to unlearn many things, to unlearn a lot of conditioning that I have grown up with, and also the new behaviors that I have adapted as I grow up. And I
Mhm.
hope that changes for me too.
Yes, Pratha, it
And
will.
thank you so much, Dr. Chhabra, for
Mhm.
being here.
Thank
Thank you for actually taking the time out. I know you've been so busy. Honestly, I usually, by the way, for people who are joining in, I usually do this on Fridays, but Anukriti didn't have the time. But I really want her on my show. I think
you.
there's so much perspective that you have given us today, and I'm taking a lot of learnings just in this 40-minute conversation, and I have a feeling that we need to do another one as well because of the depth and the scope of public health in
Yeah,
general, and how that, because that
but it's nice,
directly
Pratha.
affects
I
our
didn't
life.
realize 40 minutes got over.
Yes. I'm
Yeah.
glad you didn't. And thank you once again, and thank you everybody who joined in. Really appreciate it. And
Thank you
you
so
can
much.
find
Thank you, Sonal.
you can find Dr. Chhabra on LinkedIn, and you can find her on Instagram as well. She's been tagged on the post that I shared about this conversation itself, which I will be the video for which I will be sharing soon. So thank you, and have a good
Thank
evening
you so
and a
much,
good
Pratha. It was
weekend.
really nice talking to you.
Amazing. Bye.
Bye bye.